Okay, this is about OCD and about diagnosis and reliability and validity. And the way it's actually diagnosed is with the Y box, which is the Yale-Brown Obsessive Compulsive Scale, which is a semi-structured interview which assesses how severe the symptoms are. So that's what we've been looking at. And we talked about the benefits of a semi-structured interview in terms of the researcher can get a bit of rapport going, which avoids social desirability bias and those sorts of problems. But on the other hand, it obviously takes a long time and the interviewer has to be well trained to be able to do that. Now, there are various different evaluation points that we can look at. Reliability is the first issue. So is diagnosis consistent across different psychiatrists? We want to have a system where you can go to different psychiatrists and you should still be diagnosed either with or without OCD. It should be able to be consistent across different people. It shouldn't be just subject to the whim of a random person, whether they're in a good mood or not. We should have a decent system that means we are reliably diagnosed with OCD or not. Validity is a second issue, which looks at, is it really a disorder? So the issue is we want to make sure that we are being diagnosed properly and accurately. We don't want to be diagnosed with OCD if actually our symptoms fit with OCD but they're part of a different disorder. So that's important. And we're looking at two kinds of reliability, inter-rater and test-retest. And test-retest is about if one person has OCD, they should be able to take the test twice on different occasions and still get the same result. And that's important because it shouldn't be that, you know, you take it when you're in a good mood and you don't have OCD, and you take it in a bad mood and you do. It should have good reliability and diagnose you on different occasions still with OCD. So that's important. But the timing's important when you're actually checking that, because if it's too close together, then you probably do really well because you remember the test, or if it's an exam, that's kind of the way we talk about it. If it's too far apart, potentially your symptoms might have changed. So that's an issue that kind of occurs with the research. Now, inter-rater reliability is all about different people coming up with the same result. So we should have a system where you can go to different psychiatrists and still get the same diagnosis. We don't want it to be like one psychiatrist thinks, oh yeah, well, whatever, I'll give you a diagnosis. It should be an accurate thing that's going to be reliable between different researchers. So when we've done this before, we've looked at it in terms of observers observing the same thing and getting the same result. But in this case, we're looking at different researchers, different psychiatrists, should all use the same system to get the same result, and that's important. Now, this has been looked at for OCD specifically. We're looking at really, does Y-box get the same result? Because that's the diagnostic system we're talking about. And Woody found that inter-rater reliability was really good, which was good, but test-retest not so good. But other studies have found good test-retest. So the issue here actually was that there was 48 days between the two tests that Woody did, and in terms of OCD, actually patients often report a difference in symptoms between those times. So Brown, this is the opposite, another study, found that if there was a shorter gap, then retest for Y-box was really good. Now, if we move on to validity, which is like how accurate is it, the first thing that we're going to look at is comorbidity. Now, I don't know how well you can see that. The contrast is a bit difficult, isn't it? There we go. The first thing we talk about is comorbidity, and this is actually about, does it discriminate between different things? So if your symptoms fall within here, you shouldn't be diagnosed with OCD necessarily, because it might be that what you actually have got is depression and your OCD symptoms are just happen to overlap. So what we should be able to find is that we've got a good system that diagnoses you with OCD as something that is distinct from other disorders. If actually you're suffering from depression, it's not helpful for you to be diagnosed with OCD just because you share some of the symptoms. So that's why we talk about comorbidity as being important. It's looking at the condition as something that actually exists separately from other things, and that's called discriminant validity. And Rosenfield found that patients who were diagnosed with OCD did have higher Y-box scores, so that suggests that Y-box does have good discriminant validity. On the other hand, Woody did find it didn't discriminate well from depression, so two slightly contradicting studies there for you to think about. Now the other thing is that what we want is it's the same issue, that we want it to have discriminant validity, and what the DSM does in order to actually improve this is it warns people not to diagnose, and that's important because there are all these other things that I've put up here, the other disorders that do share similarities with OCD, that share symptoms. So the fact that the DSM warns about that is a really good thing, and it increases its discriminant validity. And that's more information about that same issue. Now, we talked about issues with questionnaires, and it's important actually that an interview is used with Y-box, because we've got all the problems of social desirability bias and so on, and particularly with OCD patients, their intrusive thoughts or their compulsions may be embarrassing, so they may not be honest, they may not want to handle a questionnaire, and they may not be that aware of how bad their symptoms are because they've maybe got used to them or something. So that's why it can be really helpful to interview close friends and family. So that's one more issue. And then what we've got here is the difference between DSM and ICD, which are two separate systems. DSM is concerning just psychology. ICD is a wider system including medical diagnoses. So the problem here was that someone tested the two and found that 95% of their sample were diagnosed with OCD compared to 46% using ICD criteria. So we're suggesting as a result of this study that the DSM is clearer and more detailed, which means it's more valid. So that's another issue. Now, cultural bias is the last thing that we think about, because what we should want is that a system should be valid across lots of different cultures. And OCD does occur in other cultures, but the problem is that the symptoms are often different in different cultures. So you've got an example there. And what we want is for the symptom checklists not to be culturally biased. The Y-box was actually produced in America, so it's important that if another country is using it, that they appreciate it may not be culturally valid in their situation. So there's another example there. On the other hand, this last person actually found that it wasn't as bad as suggested. So it's just worth being aware that if used in other cultures, it's important that, particularly where you're identifying obsessions and compulsions, that it's adapted to suit that culture. And there's a potential question.